Hi everyone, my name is Laura. First, I appreciate you taking the time to watch this video. This is certainly a very unique time right now, and one thing this unique time has showed us is the important relationship between collective action and community health and safety. So thank you for taking the time to listen to these important changes. We're glad you're a part of this with us. We know a large part of both physical and mental safety involves access to clear and accurate information. So the purpose of my video is to give you a broad overview of our response to COVID-19 and also provide some transparency into how we designed our integrative approach. Whether you're new to Bierman or returning to services after a small break, you can be assured that safety remains our #1 priority. We're following guidelines that are established by the CDC as well as local public health departments. In addition to adherence to strict safety guidelines, we've used feedback from our team and client families, which both help shape our day-to-day practices. We understand the stress and worry associated with COVID-19. Trust me when I say we are all in this together and taking this one day at a time. You may be wondering, how can ABA be done safely with all that's going on? Please be assured that we've created a multi-level plan that protects our children, families, and team from the risk associated with COVID-19. We understand the complexity of this issue and have responded at both the individual and organizational level. We're dedicated to prevention, protection, and sharing accurate information throughout this process. And trust when I say we have checked and double-checked to ensure a safe environment that minimizes risk of exposure. So as we transition back into therapy or transition from one location to another, you might be wondering what to expect from Bierman ABA or what this might look like. First, you can expect centers will be thoroughly cleaned and disinfected and equipped with a blueprint to maintain the safest conditions possible. There's a well-thought-out plan for a safe work environment that protects team members, clients, and families alike from the risk of COVID, with a large focus on exposure and transmission and keeping everyone as safe as possible and minimizing those risks. The third, Amanda will talk about a little bit later, but we know these changes are challenging and new and something different from everyone. So we've designed a support system for both employees and families as they adjust to these new changes and realities presented by COVID-19. As far as what this might look like, let's start with the physical environment. So this is an approach that starts with thinking about the physical aspects in space, meaning strategies and resources in the physical environment to reduce risk. Speaking of what this might look like, let's start with the physical environment, meaning strategies and resources in physical space that will help reduce risk. And again, that starts with increased cleaning and sanitation, specifically cleaning throughout the day, increased behavior check cleaning of client areas, and additionally, daily professional cleaning and weekly deep sanitation. So in addition to cleaning, there'll also be more sanitation stations readily available with sanitizer, and of course, all sinks will have appropriate soap, and so the sanitation supplies will be readily available and in a place anyone can get to very quickly. We'll be able to provide personal protective equipment, including gloves. Another change is that every client will have a designated therapy space. Each client will have their own designated space and stay there all day in order to reduce transmission and exposure risk. Within those spaces, there'll also be more mouthing bins and things like that to keep the individual space disinfected and as sanitized as possible. In addition to their own therapy space for therapy, there'll be no group play at this time to keep everyone safe and minimize exposure. And there'll also just be more storage units for clients to keep everything separate and compartmentalized and keep services safe. Additionally, the following changes to day-to-day procedures will be put into place. There's an adjustment to how schedules will be set, meaning behavior techs will work with only 1 to 2 children per day to limit exposure. There'll be daily temperature checks for both children and employees, and a health screening checklist done every day for both children and employees, and it'll be done at the door before entering the building. There'll be a new drop-off and pickup procedure to limit exposure, and we'll continue to implement policies that encourage those who are sick to stay home. As I wrap up my section, I want to stress that both your safety and your voice are valued. Sharing your thoughts and asking questions facilitates a broader culture of health, safety, and well-being for all of us. Lastly, not only do we care about your feedback, it's an essential part of this process to keep everyone safe. Those of you, both employees and parents who work directly with kids, know how this looks the best and have the best insight of how the process can be improved. Again, thank you so much for listening.
Hello, my name is Amanda, and I'm going to be reviewing some of the safety guidelines and measures Bierman has implemented center-wide, as well as home safety guidelines. Our goal is to ease your mind as we continue to work through this pandemic and return to a new state of normalcy. Helping me with these guidelines is one of Bierman's operations managers, Lindsay Soares. Lindsay manages our Randolph, Massachusetts location and has been working diligently with team members and families there to ensure safety. She has firsthand experience implementing all the protocols that we will be discussing shortly. Hello, Lindsay.
Hello.
Lindsay, as you know, Bierman has been working hard to get everything center ready. But before we cover safety measures specific to the center, what are you doing currently to ensure safety in our home programs?
Yeah, so our home programs have been implementing a lot of procedures. One of them is a BT acknowledgement form, and this is just basically a form that says that the team member is going to notify us if they're going to be attending any gatherings of 10 to 25 or more people, and that really just depends on the state that they are in. We're also utilizing a parent consent form, which outlines potential risks, and the parents sign this before we do start those in-home services. We are also utilizing a BT checklist at the start of each session for the parents. So this flags any concerns of possible COVID-19 exposure, any symptoms, and if we get a yes to any of the questions that are on this checklist, a BT will flag it and the therapy is suspended. The sanitization materials and PPE are also being offered to all of our behavior technicians. We have sent home cleaners, gloves, masks for all of the BTs who are in client homes, and we're also doing some frequent hand washing measures that are being implemented across all of the behavior techs.
Now, as we ease back into the centers, what specific precautionary measures have you taken to ensure safety around the center?
So each OM is responsible for ensuring that their clinics are set up in the safest way possible. And some of these measures include designated client therapy space, which is set up for social distancing, sanitization stations, and mouthing bins, which are easily accessible and placed throughout the center. We have PPE available for use, so gloves and masks are available to all of our employees. And we're also stocking up on cleaning products, so we have ample amounts within the center.
And what are sanitation stations?
Sanitation stations are bins with gloves, hand sanitizer, and disinfectant that we have strategically placed around the center so they're accessible to all of our behavior technicians.
And could you show us an example of how a center has designated sanitation stations in client work areas?
Yes, absolutely. So we're going to take a look at a layout that is being implemented in our Cranston location right now. As you can see, the clients are strategically placed around the center so that we're maintaining a distance of at least 6 feet or more between the clients as well as the adults throughout the centers. And you'll also notice that wherever we have one of the clients who are in a designated area, we also have a designated sanitation station for that client as well.
Wonderful. And what are some ongoing measures that we're using to maintain safety day to day?
Yeah, so we're adhering to all of the social distancing guidelines by keeping a 6-foot distance between others at all times, even during nap and lunch times. We're also conducting therapy in designated client therapy spaces only. We're also implementing lunch schedules, which is staggered for both clients and team members, and lunches are eaten separately away from others. We're also staggering bathroom schedules to limit the number of people who are in the bathrooms at a specific time, as well as increasing cleaning and sanitizing throughout the day, and increasing the frequency of professional cleaning services to 3 to 5 times a week. We implement a checklist for increasing hand washing throughout the day. We recommend at least once per hour, and we're adding a designated person to disinfect at specific times throughout the day. And of course, we're using parent consent, so we're going to continue to implement for clients starting in home, and this is going to be carried over to the center.
That's terrific. So, what is Bierman doing to maintain the safety of each individual entering the center?
So Bierman is implementing the pre-session checklist in the center and continuing this in the home. We are also screening all employees and clients through temperature checks when they're arriving at the center. We will not allow an individual with a fever to enter. PPE is also readily available for all of our team members. We've also implemented new scheduling guidelines that minimizes cross-contamination and contact. And this schedule pairs up 2 behavior technicians with 2 clients. And with this schedule, each behavior technician would work with 2 clients at a maximum. It also does not allow any behavior technicians who are working in the home to come into the center and vice versa to avoid that cross contamination there as well.
Great. So, if I'm a parent, how can I be assured that Bierman is doing everything to make me feel safe dropping off my child each day?
Yeah, so I understand it can definitely be uneasy given the current circumstances, but we've changed some of our procedures to ensure safety. For example, we've implemented a staggered drop off procedure. So, behavior technicians are required to wear masks at drop off and pickup. And we've also asked that parents and guardians do the same if they're going to be entering the building. Parents will text the center upon arrival and will be notified when it is safe for them to come into the center. If 2 clients come into the building at the same time, we have a designated waiting space to ensure that 6 foot distance. And as mentioned before, temperature screenings take place during drop off, and the pre session checklist will also be implemented during this time.
What are some things I can do to help?
So, just really keeping up with emails and protocol changes as they're helping us to maintain that safety in the current state, and continuing to implement self screening measures and flag any potential illness for yourself or your child if you are a parent. Following all local guidelines and ensuring that you're doing the best to keep yours and others around you safe.
Wonderful. Thank you, Lindsay, for helping us maintain safety in your location and with Bierman as a whole. We appreciate your time.
Well, thank you for having me.
Let's take a closer look at the cleaning checklist that we will use each day. The first one is the BT Daily Cleaning Checklist. The High Touch Areas Checklist is next, as well as the cleaning procedures for client toileting and for diaper changing. This is the BT Daily Cleaning Checklist. Each BT is responsible for completing this during their session. So you're going to follow the steps, and once they're complete, you're going to check it off. You can put the client's name at the top as well as your name if you are a BT next to it. As you go through these steps, you'll notice that some of these may not be applicable for your session as they're to occur at the beginning of the day or at the end during pickup times. What you're going to do is complete the steps that are applicable to you. The first thing is to take the clients to wash their hands upon arrival, or if it's a transition to your session, you'll do that then. Then you're going to wipe down the client's lunchbox before putting it in the fridge. Wipe down their entire area before beginning therapy. You should have the list of items and make sure that that's in the space that is designated as therapy space, and make sure it's updated of all the items that have come into the center. Wipe down the lunchbox before putting it in the backpack to go home, and then take the clients to wash their hands before getting picked up as well. You're going to wipe down entire client area after they leave. You can do this at the end of your sessions too, but it is going to be required at the beginning of each therapy session. This is the High Touch Areas Checklist, and this is intended to be used for the person who is designated to clean throughout the day. This is going to be for all of those high traffic areas like door handles, light switches, and tables, and we need to make sure that it's cleaned every 2 hours. This log is going to be stored in a very accessible place in case that cleaning person changes throughout the day. We can just find it very easily. So the way that this works is that you'll notice that at the top there are different designated 2-hour blocks so that we know that those checks have to happen between those times. The first is the opening check, and that's going to be done before the clients arrive ideally or as they're coming in. So those things that need to be completed each day are to disinfect all doorknobs, light switches, tables, chairs, toilet handles, and sink fixtures. There's other common area things too that need to be wiped down. So the lobby areas, the kids' cubbies, the break rooms, and the staff bathrooms also have to be completed. The way that this works is that the BT will write their name in for that first check. The time doesn't actually start until the first block of 2 hours, which is 8:30 to 10:30. So the BT will come in and write their initials and write the time that they completed this check. At that point, that will start cascading to our next checks. So every 2 hours at that point, we will make sure that it's being completed. If the first check is done at 9 o'clock, then 2 hours from then will be 11 o'clock, and that's when the next time the cleaning is due. And this will continue throughout the day until the client is picked up. This is the cleaning procedure for client toileting. that the BTs will use each time they take the child to the bathroom. The BTs will use this checklist and keep it on their clipboards so that they have it easily accessible for bathroom breaks. BTs will make sure that they're wearing a mask and gloves to the bathroom in case you pass others on the way, or if someone's already in the bathroom. All wiping down will be done with Clorox wipes. So they'll put the client names at the top and then the BT names next to it. And then as they go, they'll just initial each step. The first thing is to wash your hands before using the bathroom, and then wipe down the handle of the toilet before use, wipe down the whole toilet area after use, wash both you and your client's hands, and then wipe down the entire sink, paper towel, soap area. So everything's going to be cleaned throughout the entire process of toileting. This is the cleaning procedure for diaper changing. Each BT will use this checklist for anyone who is in diapers, and they'll make sure that it's on the clipboard for easy access. So they're going to follow each step every time the child is taken to the bathroom, and BTs will wear masks and gloves to the bathroom in case you pass anyone else along the way, or in case someone else is already in the bathroom. So wiping down will always be done with a Clorox wipe. At the top is a spot for the client's name and then a spot for the BT's name. And each step they will complete and then initial after completed. So they're going to wipe down the mat before each use, wipe down touch products after use, so baby wipes, sprays, creams, etc. Wipe down the mat after use, wash both the client's hands and the BT hands, and then wipe down the entire sink, paper towel, soap areas. Everything will be completed daily, and there's a spot at the top for the date.
Next up are additional protocols and response plans. Reporting illnesses and symptoms is very important because it keeps both our team members and our clients safe. In the event a client or an employee becomes ill during a session, they should remain in the area where they are and not move about the center until it's time to go home. Sanitize the BT and client's hands, and BT should put on a mask if feasible. BT should notify the OM, the ACL, or a BA immediately, and then that will get escalated to the RDOs. If an RDO is unavailable, contact the RDC. If client pickup is required, access the emergency binder and follow the pickup protocol. These binders can be found in a designated place in your lobby or near the front entrance. The room should be immediately disinfected. Symptoms. So the following indicators should be shared with all families and staff members. If any staff member or client exhibits any of these symptoms, they will be asked to stay or return home. A return to the center will be determined on a case-by-case basis. So we're looking for temperatures of 100.4 or higher, persistent low-grade fever somewhere between 98.7 and 100.3 degrees, coughs, shortness of breath, sore throats, rash, diarrhea, or vomiting, or any other symptoms that would warrant cause for concern. So if we were to have a positive COVID-19 diagnosis, this is our response plan for that. Confirmation of a positive diagnosis of coronavirus within a center may require a quarantine. A quarantine will require a complete closing of the center and quarantine of affected staff and clients. Timing and pace of reopening will be decided on a case-by-case basis, and during the quarantine period, the affected staff and clients may continue to participate in telehealth services if it's feasible. If the determination is made that a quarantine is required, follow the protocol below. So we're going to immediately stop center-based services in the affected facility. We're going to advise all parents and guardians to pick up their child immediately, and we prefer that to be within 30 minutes. Wash hands and sanitize the area in which you are waiting for pickup, and provide the child's backup change of clothes upon pickup as well. Allow staff to leave as soon as feasible, and no reentry permitted without advance notice. Professional cleaning and disinfecting services will be scheduled at least 72 hours later. Should you have any more questions regarding any of our protocols or any of our safety measures that we have implemented, please reach out to your OMs, and their contact information is listed here on this page. Thanks for tuning in.